All right. Today is March 14th, and I'm here with Vivian, and she had a mild procedure. When was that done? It was done on the 11th of last month.
Correct.
And I wanted to just take a moment and discuss with you and with her the clinical indications for mild, and then also her experience. Mild is a procedure where we take a little bit of ligamentum flavum out of the back of the spine, allowing decompression and essentially breathing room for the nerves in the low back as they go to the legs. The three criteria that one has to have in order for this to work is leg pain with walking, that's really relieved with sitting. It's not for back pain per se, it's more for leg pain. Secondarily, they must have central canal stenosis, narrowing in the center of the spine. And then lastly, an absence of narrowing in the side of the spine that could explain the leg pain. And that really only can be seen with an MRI to make that determination. But the principal importance is the patient has to have leg pain with walking, largely relieved with sitting. So Vivian had the mild about a little over a month ago. And can you tell us a little bit about what you were feeling prior to the mild, and then what the mild was like, and then what your experience after the mild procedure's been? Please.
Before I had the procedure, I waddled like a duck. I was in constant pain if I walked or stood for anything more than 2-3 minutes. Mm-hmm. And after I had the procedure, the very same day, I walked up 2 flights of steps to a neighbor for dinner and had no problem whatsoever, and I've had no problem with walking since.
Wow. What was the procedure like? You had 3 levels done. Was it lengthy, painful, any complications or problems afterwards?
No
like that?
problems afterwards. I had a very charming doctor who spoke to me and kept me calm and pretty much focused the entire time. I felt no discomfort, and if he feels it will help somebody else, all I can say is go for it.
Okay. Now, we did yours without any sedation. We didn't give you any anesthesia. The only thing we used is local anesthesia.
Right.
Any trouble with that?
No.
Okay. Okay. The reason I like to do that is if the patient is feeling any leg pain during the procedure, it is one of the stopping points. And so I've been doing only local anesthesia for this procedure, so which is great because there's no anesthetic risk with it.
I appreciate that.
Oh, absolutely, but I think it also reduces the likelihood of there being any nerve injury during the procedure because you're awake and you can talk to us. Okay. Thank you very much.
You're very welcome.